Have you ever wondered why some older adults struggle with urinary control? Urinary incontinence is a common but often overlooked issue that can affect quality of life and confidence. The good news is that simple lifestyle changes, exercises, and the right supplements can make a big difference. Let's explore some easy, practical tips to help improve bladder health and regain control. 1. Vitamin D. Vitamin D is a fat-soluble vitamin important for bone strength, immune health, and muscle function. It helps the body absorb calcium and supports muscle control, including the muscles of the bladder and pelvic floor. In older adults, low levels of vitamin D are linked to weak muscles and poor bladder control, increasing the risk of urinary incontinence. This happens because vitamin D receptors are present in bladder and pelvic muscles. When these muscles are weak, it becomes harder to control urination. Vitamin D comes from sunlight, oily fish, like salmon, egg yolks, and fortified dairy. But many seniors don't get enough, so supplements are often recommended. A common dose for older adults is 1,000 to 2,000 IU daily, but a doctor may adjust this depending on individual needs. Taking enough vitamin D may improve muscle strength, reduce urinary leaks, and support a better quality of life in elderly people. 2. Vitamin B12. Essential for healthy nerves and red blood cell production, this nutrient supports the brain and spinal cord, which are key to bladder control. In aging adults, low levels may lead to nerve damage, especially in the pelvic area, resulting in urinary urgency, leaks, or incomplete emptying. Found mainly in animal products like meat, dairy, eggs, and fish, it's often lacking in older adults due to poor absorption or limited intake, especially in vegetarians. When deficiencies occur, symptoms like numbness, weakness, and bladder issues may appear. Daily supplements ranging from 500 to 1,000 micrograms, often taken under the tongue or by injection, can help restore healthy levels. Maintaining proper intake improves nerve signaling to the bladder, reducing incontinence symptoms and enhancing quality of life in seniors. 3. Magnesium. Crucial for muscle relaxation and nerve function, this mineral plays a key role in regulating bladder activity. It helps calm overactive muscles, including those in the bladder wall, which may reduce urgency and frequency of urination. Low levels in older adults are common and can lead to muscle cramps, spasms, and increased bladder sensitivity. Many seniors with incontinence may have an undiagnosed magnesium deficiency. Found in foods like leafy greens, nuts, seeds, whole grains, and legumes, it's often not consumed in sufficient amounts, especially in people with poor diets or digestive problems. Supplement doses usually range from 250 to 400 milligrams daily, depending on individual needs and tolerance. Adequate intake can help relax bladder muscles, improve nerve signals, and reduce episodes of urinary urgency or leakage, making it a useful support in managing incontinence naturally. 4. Zinc. This important mineral helps the body repair tissues, fight infections, and keep the nerves healthy. It also plays a role in hormone balance and muscle strength, two things that are very important for bladder control. In older adults, low zinc levels can lead to weak pelvic muscles, more bladder leaks, and even frequent urinary tract infections, UTIs. Since the bladder and its surrounding muscles rely on strong tissue and good nerve signals, zinc becomes very helpful. Foods rich in this mineral include red meat, seafood, especially oysters, dairy, eggs, nuts, and whole grains. But many seniors don't eat enough of these foods, or their bodies don't absorb the zinc well, so they may need a supplement. Most older adults can benefit from taking 10 to 15 milligrams of zinc per day. Getting enough zinc can help keep the bladder strong, improve how the nerves and muscles work together, and reduce the chances of leaks or urgency, especially in those who often get bladder infections. 5. Probiotics. These are good bacteria that live in the body, especially in the gut and urinary tract. They help keep the balance between helpful and harmful microbes, which is important for digestion, immune health, and even bladder control. As people get older, the number of these good bacteria may go down. This can lead to more infections, especially urinary tract infections, UTIs, which are a common cause of bladder problems and incontinence. Probiotics help prevent bad bacteria from growing too much. They support a healthy urinary tract and may reduce inflammation in the bladder. For seniors who often have bladder infections or leakage, probiotics can be a natural way to improve symptoms. They are found in foods like yogurt, kefir, pickles, and other fermented items. You can also take them as supplements. Look for probiotic strains like Lactobacillus rhamnosus or Lactobacillus reuteri, which are especially helpful for the urinary system. Taking probiotics regularly can help protect the bladder, reduce leaks, and support overall health. Key lifestyle tips. 1. Monitor medications. Many medications, such as diuretics, sedatives, or muscle relaxants, can affect bladder control. If urinary symptoms worsen after starting new medicines, consult your healthcare provider to review and possibly adjust your medications. 2. Pelvic floor exercises, Kegels. Strengthening the pelvic floor muscles is one of the most effective ways to improve bladder control. These muscles support the bladder, urethra, and bowel, and when they are weak, urine leakage can occur. Kegel exercises involve tightening the pelvic muscles as if stopping the flow of urine, holding for a few seconds, then relaxing. Doing 3 sets of 10 to 15 repetitions daily can gradually build muscle strength. Consistency is key, and results often appear after a few weeks. These exercises can be done anywhere and anytime, making them easy to include in daily life. 3. Stay hydrated. Drinking enough water is essential to keep urine diluted and reduce bladder irritation. However, drinking large amounts of fluids, especially caffeinated or sugary drinks, at once can overwhelm the bladder and increase urgency. It's best to sip water throughout the day and reduce fluid intake 1 to 2 hours before bedtime to avoid nighttime bathroom trips. 4. Avoid bladder irritants. Certain foods and drinks can irritate the bladder lining, increasing symptoms of urgency and frequency. Common irritants include caffeine, coffee, tea, and soda, alcohol, spicy foods, citrus fruits, and artificial sweeteners. Limiting these can reduce bladder inflammation and help improve control. 5. Manage constipation. Chronic constipation can put pressure on the bladder and pelvic muscles, worsening incontinence. Eating fiber-rich foods such as fruits, vegetables, and whole grains, along with drinking plenty of water, helps keep bowel movements regular and reduces strain. 6. Control blood sugar. High blood sugar levels, especially in people with diabetes, can damage nerves that control the bladder. Proper blood sugar management through diet, exercise, and medication is crucial to prevent or reduce urinary problems. 7. Maintain healthy weight. Excess body weight increases pressure on the bladder and pelvic floor muscles, making urinary incontinence worse. Losing even a small amount of weight can significantly improve bladder function and reduce leakage. If you found these tips helpful, please give this content a like and share it with your friends or family who might benefit. Don't forget to follow for more health advice and easy-to-understand wellness tips. Your support helps us create more valuable content to improve the lives of many seniors dealing with urinary challenges. And always consult your doctor before starting new supplements or exercises, especially if you have medical conditions or take medications.